Orthognathic surgery, or jaw surgery, is something that we do quite a bit of here at Sarver Orthodontics. What we emphasize is the interdisciplinary approach, which involves other specialties of dentistry, your dentist, and other specialties of medicine, which we will, of course, demonstrate for you. This girl had undergone orthodontic treatment actually a couple of times to get her bite corrected, but what was not addressed actually was what was important to her was her appearance. In other words, we'd all recognize that her lower jaw is not as prominent as we would like it to see. Her smile looked great, and it fits all the criteria of what we like to see in good smiles, but the profile was a bit of a problem. And also, one thing that she didn't recognize that we do recognize is the sort of round face that she has is a result of what we call height-width ratio. In other words, her lower face is somewhat shorter than it should be relative to the width of her face. And we'll show you how we take that into account in the planning. Her bite relationships are decent. They didn't quite get there, and it was a very difficult case given her skeletal relationship to do that. When we look at her x-ray, you can see how far behind her lower jaw is relative to the upper face, and so that is the major problem. Our objective of orthodontics is to dentally decompensate for the skeletal relationship. In other words, what has been done was to try and pull the teeth together without changing the skeleton. The upper incisor relationship and the lower incisor relationships are numerically good by orthodontic standards. What we plan to do is to remove 2 lower first premolars, and the object is to give us space to move the lower teeth back. In essence, what we're doing is creating a bite to match her profile. The orthodontic plan then is to extract these 2 lower teeth, and we are going to retract the lower incisors into that space. We're going to attain ideal upper incisor relationships and maintain that, since that was good to begin with, but we want to attain what we term maximum overjet, or increase the distance of the top teeth to the bottom teeth, and we want to maintain the upper incisor height and her smile arc, which are all characteristics of a great smile. The surgical plan then is we're going to bring her lower jaw forward, and that's obvious that we're going to do that to fix her bite, and that will improve her profile some. But what we also plan to do is enhance the appearance with advancement of her chin, which makes the chin neck contour and chin neck length even better. And we're going to vertically bring the chin down and add more length, and the reason for that will be obvious in the finish. We're also going to perform submental liposuction to take the fat out of her neck, and rhinoplasty because the dorsal hump that she has and is an aesthetic issue to her. This is our patient after we have retracted the lower incisor. You see that her profile looks a little bit worse, but not much. Dentally, you see that the lower teeth have been extracted and we are closing space. Lower jaw forward, chin forward, and down to add length to the face for height-width ratio. In other words, we wanted to make the face not quite as round by adding length to the lower face. Submental liposuction and rhinoplasty. So here she is only 3 months after her operation, not wired together, and her profile. Final bite relationship, final outcome. Notice that the round face is gone, and what we've done is we've increased the lower facial height. Smile is still very good, maybe even better if I might say so myself. And then a profile view is a vast improvement of what she had before. The oblique view shows the chin neck angle area where that is now well defined and looks great. And the before and after profiles are self-explanatory. Great improvement, great enhancement with all the things we have to offer. Please go to the website and look at the patient surgery guide, which is about 18 pages and can walk you through this entire procedure. And there's lots of other material present on the website for you to review.